you everyone for your patience. We are about to kick off part 3 of our 4-part Black Voices Matter series. So thank you for your patience and thank you for joining us. We do have Rick that is on the line, and he will be continuing to admit our participants as we begin the show. So I want to welcome you to the Black Voices Matter. I would also like to take a moment to reflect on this week in Black history. In 1919, W.E.B. Du Bois organizes the first Pan-African Congress in Paris. William Edward Burghardt Du Bois was an American sociologist, socialist, historian, civil rights activist, Pan-Africanist, author, writer, and editor. He was born in this month, February 23rd, 1868. If you would like to learn more about W.E.B. Du Bois, please visit AAERG's SharePoint site and visit our calendar of events. Welcome again. I am Danielle Hairston-Green, Institute Director for Human Development and Relationships, Chairperson for the African American Employee Resource Group, and District 530 Representative for the Academic Staff Council with UW-Madison. Thank you for sharing your lunch hour with the African American Employee Resource Group, affectionately known as AAERG. As we continue to engage you in meaningful dialogue during our inaugural Black Voices Matter discussion series in recognition of Black History Month. The AARG purpose is to serve as a resource for and foster current and future African American colleagues' success by sponsoring programming, providing collegial support, encouraging belonging, and raising a collective voice related to issues that impact employees' ability to thrive personally and professionally. We would love your feedback, and so we will provide a link to the survey in the chat box at the close of this session today. First, before we begin with our amazing speaker, I want to acknowledge our committee members, Don Danita Fleury Simmons, who's the co-chair and Professional Development Committee chairperson, Rick Mills, who is the secretary, and members and events interim chairperson, Eva Terry, who is the treasurer, James Bowling, who's retention and recruitment committee chairperson, and Hawania Thompson, who is the chairperson for the marketing and media committee. So we have everyone. Let me make sure everyone gets in. Okay. All right. So I am super excited to introduce to you our third presenter, educator, medical professional, and entrepreneur, Dr. Julianne Adams-Burt. Dr. Adams-Burt is a leading voice for women's health. In her 16th year of practice, she is the founder and CEO of Radiant Women's Health in Metro Atlanta. She landed south from Harrisburg, PA in 1991 to matriculate at Clark Atlanta University, taught high school science and health in the Atlanta public schools, and then obtained her medical degree from Morehouse School of Medicine. She served as the solo chief resident and was the first Black female physician to graduate from Allegheny General Hospital's OBGYN residency program in Pittsburgh, Pennsylvania in 2015. Her fervor for women's health and notably female sexual health and dysfunction has brought her before the FDA and US congressmen advocating for sexual health equity for women. She has also served as an advisor and speaker for several pharmaceutical companies and has had the pleasure of presenting at national and international meetings. With an ongoing presence in local schools, churches, and community forums, she formed Dr. Ju Delivers. Her platform she uses, Pushing Wellness for Women. She proudly served as the 2017 president of the Atlanta Medical Association, the pillar organization upon which the National Medical Association was founded. She is past president and chairman of the board of the AMA, secretary for the Georgia State Medical Association, and recently elected to her second term in the Council of Concerns of Women Physicians for National Medical Association, where she now serves as vice chair. Dr. Bird is also a board member of the Heritage Fund of the Atlanta Medical Association and spearheaded the establishment of an endowment to provide scholarships to minority medical students. She graduated from the Georgia Physician Leadership Academy, a one-year program established by the Medical Association of Georgia to foster leadership and advocacy in medicine. She's fluent in American Sign Language. She serves as a church interpreter for the deaf. She is also a life member of Alpha Kappa Alpha Sorority Incorporated, proud sorority sister of our newly elected U.S. Vice President Kamala Harris. Dr. Bird has received numerous awards for her business and community work. Despite the challenges and joys of juggling a practice amidst her community and leadership endeavors, the role she most passionately reveres is that of wife and mother. To review her full bio, please visit the AAERG SharePoint site. But without further ado, I would like to introduce to you Dr. Julianne Adams Bird.
Thank you. Thank you so much for having me. Share my screen. So we're going to jump right into it. I am so honored to have been asked to participate in your forum today. And we are going to discuss the health disparities in the African American community. But before I share words with you, I thought it would be a good way for you to visualize instead of me just telling you. So here we go.
I know in this situation an apology is not enough, but from the heart of this hospital, I'm here to offer one. Your wife suffered what we refer to as a never event, something that should never happen.
I got an email out of the blue from an executive at the resident. And then she goes on to tell me, we'd like to do an episode of the show inspired by Kira's story and then dedicate the episode to Kira. And I was like, what? Kira went in for what was expected to be a routine scheduled C-section at Cedars-Sinai Hospital on April 12th of 2016. And we expected it to be the happiest day of our lives.
I'm scared. You're gonna be okay. Everything is gonna be okay. All right, I'll take it from here.
The doctor tells me she'll be back in 15 minutes. 15 minutes. And that was the last time I saw my wife alive.
This happens far too often to women of every color.
But it's 4 times more likely to happen to Black women. That's a fact.
The way that she touches people's lives and the way that her story resonates with people never ceases to amaze me. And I'm so honored to see these talented, gifted actors pouring their hearts into these roles. What we've accomplished together here with the residents, just couldn't have a better time for us to rally and come together and raise awareness about this issue.
The United States is the most dangerous country in the developed world to give birth in. There's no excuse for that.
Women all over this country deserve better. There's no statistic that can quantify what it's like to tell an 18-month-old that his mother's never coming home.
There's nothing I can do to bring Kira back, but the highest honor that I can pay Kira is to make sure I do everything I can to send other mothers home with their precious babies.
I know.
So I can't tell you how many times I've watched that, and I'm triggered every time. Kira Dixon Johnson. She is a name. She's not a number. She was a devoted wife and mother. We will spend the next few minutes talking about statistics, figures, facts, but I just want you to focus on this face. If we knew her, we would have known her to be very impressive. What I've read about Kira, she was fluent in 5 languages. She loved to travel. She also had a pilot's license. And she even raced cars with her husband of 10 years. And on that day, April 12th, 2016, she went to the renowned Cedars-Sinai Hospital in California for a routine cesarean delivery. I don't know if anyone watched the show, but I literally, as I've shared, am triggered every time I would watch this on YouTube. Because last year I was on call at a hospital and I walked in, that episode was airing. And as an obstetrician and gynecologist, I've seen these things happen. I've seen the deaths and I've seen the near deaths. And unfortunately, as was shared briefly in the episode, it's disproportionately affecting African-American women. For 7 hours, her husband begged for someone to come to her bedside. For 7 hours. And she died 12 hours after giving birth. What they found was that she had a laceration of her bladder. So she hemorrhaged. She had internal hemorrhage. And eventually, if you bleed out too much, more than likely, I've never reviewed her autopsy, but I can tell you as an OBGYN, more than likely she went into something called DIC, disseminated intravascular coagulopathy. It just means you bleed so much that your liver cannot keep up with providing the proteins that you need to clot. If we all cut ourselves, we're going to eventually stop bleeding because platelets go to that area and proteins go to that area to stop. She bled so much because they ignored her. So, US maternal death rate is definitely disproportionate here in the United States. Cardiovascular disease is now the leading cause of death in pregnancy and in the postpartum period. Black women's risk of dying from cardiovascular disease is 3 to 4 times that of white women. This disparity is due in part to racial bias and overt racism. You know, that's hard to hear, even as a physician, to believe or to be told that in the field of medicine, my colleagues can literally put these patients at risk. It's hard for even me to hear. The greatest health disparity in the management of cardiovascular disease for Black women usually does exist prior to pregnancy when risk factors are not identified. So we have a hard task in the healthcare in general, but it's really important for us to identify those women who may have underlying diseases that will help them during their intrapartum and their postpartum period. In 2020, we heard over and over again that we were fighting 2 pandemics in this country. When we watched George Floyd take his last breaths at the hands, or rather under the knee, of an officer, it is true that although half of the people shot and killed by police are white, Black Americans are shot at a disproportionate rate. There are about 1,000 civilians that are killed each year by law enforcement officers. By one estimate, Black men are 2.5 times more likely than white men to be killed by police during their lifetime. And in another study, Black people who were fatally shot by police seem to be twice as likely as white people to be unarmed. From racism in policing to racism in medicine. On November 29th, this woman was diagnosed with COVID-19 after originally a few days before she had tested negative. By December 4th, She was hospitalized and having to advocate for her own care. She was given originally remdesivir, but was taken off, and she was inadequately treated for her pain. She was complaining of chest pain. Her doctor told her that she didn't look bad. She wasn't short of breath, and he didn't see a reason why she needed to continue. Not only on the remdesivir, but he withheld pain medication. He withheld her narcotics. She actually recorded her harrowing ordeal with that physician. And in her own words, she said, "I put forth and I maintain if I was white, I wouldn't have to go through that." I don't know if you know the face. It is a recent story, but this is Susan Moore, or should I say Dr. Susan Moore. She's a primary care physician. She was, and she had her own run-in with racism. She recorded that video. I'm actually in a Facebook group with her, and I didn't see it on December 4th when she first played it. I saw it on December 20th, the day that she died. And that Facebook group that I'm in is a group of women from across the world, 75,000 of us who happen to be physicians and happen to be mothers. And everyone was pouring out their heartfelt sympathies to Dr. Susan Moore, our sister in medicine, because she came to this group saying, "Somebody help me. Somebody help me. He's treating me like I'm a drug addict and I'm in pain." And finally, because of a patient advocate, she was able to get a little better care. She got a CT scan, and they actually found that she had COVID pneumonia. She had new infiltrates on her scan, and she started to receive some care. She went home, but yet 12 hours later, she was being rushed back to another hospital. This is in Indiana. So she went back to the hospital, and she went back to our Facebook group, and she kept updating us until update number 17, where she said, "I'm being transferred to the ICU." And according to that Facebook page, that Facebook post, 10 days later, she had died. Now, in all fairness, Dr. Moore did have underlying disease. She was by number 4 on this list. She had something called sarcoidosis. But here you'll see the number of deaths for leading causes of death. Heart disease has been number 1 for 100 years, followed by cancer, and then accidents, unintentional injuries, and so on and so forth. But as we are all currently living, just last year, as of October, COVID-19 has become a leading cause of death in the United States. It's the 3rd leading cause of death overall for those ages 45 to 84, but it has jumped to number 2 for those 85 and older. Heart disease. We're in February. It's not only Black History Month, but we're always wearing our red, and the American Heart Association is trying to get us all to know our numbers. And that's important. Hypertension or high blood pressure is a risk factor that we do not do our darnest. I think we should do much better. Even in 2018, they lowered the standard or the values. And I could tell you that not just my patients, but I have colleagues who still do not treat their patients with the lower value. You may know the number is 140/90, but actually there are different stages of hypertension, and we should be treating those patients when they get to up to the 130s, 135, over 85. It's imperative. It's a major risk factor for heart disease. And it is more common and not as well controlled in the African-American communities, as well as Hispanic adults. So we definitely need to do better. Hypercholesterolemia is high cholesterol. Smoking still definitely adds to the heart disease risk, and diabetes. And if you just look at hypertension, hypercholesterolemia, and diabetes, those three things together we call metabolic syndrome. If you see one, we know to look for another. And if I see two in a patient, I automatically assume they have all three. And their risk of dying is great already. African Americans have a higher rate of dying from the heart disease. So we definitely need to do better. Life expectancy do vary by race and by sex. For example, among women who are born in 2015, the life expectancy for a Hispanic female is around age 84, for a white female, 81, and for an African American, 78. Definitely disproportionate. So hypertension in African Americans, greater than 40% of African American men and women have hypertension. That's a lot. And it tends to develop early in life, is usually more severe and related, like I said, to other comorbidities. And there's been research that has found that African Americans may have a gene that makes us a little salt sensitive. And I always tell my folks in my circles, you cannot, if you follow the American dietary recommendations, 1 teaspoon of salt is the recommended dosage per day for the average American. For African Americans, they need to cut that way down. So imagine, if you will, how much salt you're really taking in, especially depending on what you're eating. The high cholesterol in African Americans, just to give you a little understanding, since it's Heart Health Month, LDL versus HDL. LDL, we consider your bad cholesterol, HDL, your good cholesterol. And it's important to know, not only know the numbers, but to act on the numbers. So what does that mean? It means all that food that hopefully is not making your mouth water now, it's going to rev up your total cholesterol, namely the LDL or bad cholesterol. You got to get moving in order to improve the HDL, as well as get your fruits and vegetables in. Among African American adults, nearly 48% are clinically obese. And you compare that to white Americans at 32.6. Tobacco, still a problem. 77, or three out of 4 African Americans smoke. Usually their choice is menthol. I had to look that up. I haven't been around a smoker in so long. I was like, oh, menthol. And that's 3 times the rate as among whites, but it helps give a high effect. And so it is easier for them to get addicted and harder to quit. Moving on to cancers. The top portion of this shows you the incidence of cancers. For men, the top 3 would be prostate, followed by lung, followed by colon. For women, it's breast, followed by lung, followed by colon. But estimated deaths, the top 2 flip. Lung cancer kills men and women equally as bad. And then prostate, then colon for men, and then breast, and then colon for women. And there are other cancers, some that are not even listed on here, that I want you to be aware of. Breast cancer, of course, we know, even though there's similar rates of breast cancer amongst African Americans and white women, African American women are more likely to die. They're more likely to die. Same thing when it comes to prostate cancer in our African American men. Prostate cancer rates are actually on a decline for all races, but when you compare, African American men are twice as likely to succumb to prostate cancer. One that's not on this list because it's not in the top tier is cervical cancer. Cervical cancer rates are highest for African American women. 14,000 women are impacted by cervical cancer a year, and close to 4,000 women still die. And why is that? Because there are many factors that play into the disparities when it comes specifically to cancer. It matters where you're born. It matters where you live. It matters where you work and you play. The behaviors of your family, the behaviors in your neighborhoods, what you see. I know that I personally have learned to do a little bit better when I see a patient who, let's say I'm comparing a woman last year, I'm looking at her BMI and noticing that she's increased, so her weight has gone up. Instead of me saying, you know, miss, you need to eat better, you need to exercise, or you need to go walking. Now, I still tell them they need to go walking, but now I ask a little bit more questions. I even say to them, well, kind of pre-COVID, do you feel safe walking in your neighborhood? Because before COVID, the malls, you know, Walmart, great places for people to go out walking. But I have a very diverse, I would say, population of patients. And I don't know that my patients would be, you know, would feel safe walking in their neighborhood. So we have to, in healthcare, pay attention that everybody is not coming on equal footing. Our biology matters, the health impact of institutional racism and chronic stress that it causes. I cannot tell you how many times I mentioned to you at the onset watching the video how I get triggered. I get triggered as an OBGYN. I've seen my patients who have succumbed to their illnesses or who didn't make it because of comorbidities in pregnancy, at the time of delivery. But I'm also very aware that chronic stress, you know about fight or flight, right? If somebody came up to you and you were at the ATM and they put a gun to you, immediately, let's say right before you got out the car, you had to go to the bathroom. I will assure you at that moment, you do not have to go to the bathroom. Fight or flight rearranges the focus, right? So you're not hungry, nor do you have to go use the restroom. When you are in a stressful situation, the blood supply is not running to your stomach, it's running to your muscles so that you can run, right? Or think of what your next step is going to be. Okay, so the person goes away, you come down, the police come, and you come down. Chronic stress, think of the children who every day when they walked home from school, walked through a gang-infested neighborhood. They never come down from that high. Their cortisol levels stay up. And when you live in that type of stress, or maybe it's inside the home, maybe unfortunately their mother is being abused by her boyfriend, and they're seeing that, and they're scared for her, they're scared for themselves. When young people and adults live in that manifestation of stress, you never have a chance for your body to relax and to heal itself. And inflammation can cause all kinds of disease, including and not limited to cancer. Genetics, we know there are genetic predispositions, and that needs to be studied more. Why it's so important that we get more and more of people of color to participate in trials, drug trials. I read that with the Moderna and the Pfizer vaccine, that only about 10% in one and I think 5% in the other were people of African descent that were even participating in it. Why is that important? Because we need to know how medications and vaccinations, immunologics are going to impact us as well. So let's run through this busy slide, but COVID-19 risk in the Black communities. Now, I don't know if you know, but in the beginning of the pandemic, at least in my circle, everyone was saying, Black people don't get COVID. Black people don't get COVID, until they started seeing images of Black people dying from COVID. Here in Georgia, the places that were impacted the most were in rural areas. There were several gatherings, family gatherings. A loved one passes away and folks were getting together. And then 2-3 weeks later, families were greatly impacted and more people were dying. But here's just some information I thought was important for us to remember. We talked and celebrated the essential workers, but the essential workers put many African Americans at risk. They're the ones that were at the grocery stores. They're the bus drivers, the transit workers, the sanitation workers, the caregivers. Among urban residents, about 34% of African Americans use the public transit, right? Compared to 14%. So when someone gets on CNN or the local news and says socially distance, but I gotta get to work. How do you socially distance? And it took us all a while to finally do what? Realize we needed to be wearing a mask. Notice how that's right near me, right? The mask is right there. We don't live without that thing. And we've already talked about the high blood pressure being a risk. Inequities in access to healthcare. If I can't get to the hospital, if I live far from the doctor who takes my insurance, how can I get there? How can I be seen? How can I make sure that I'm taking care of my preventative services, right? African Americans still today are more likely to be uninsured or underinsured. And you see here the poverty level is disproportionate as well. 20% of African Americans live in poverty compared to 10% of our white neighbors. Per the CDC, cases of COVID-19 in Blacks are 1.1 times those of whites. Hospitalizations are 2.9 times, and deaths are 1.9 times. I added that because I did a little research, y'all. I came to y'all state and I looked at y'all. I was like, oh, let me see what they got going on. And wow, okay. The number of cases, there are only 8% Black in the state, 8 point something. It was less than 9%. And yet the cases for African Americans per 100,000 was greater than whites, not overall. You see Hispanics take the lead in that. Hospitalizations, Black folks are being hospitalized more. And I don't know if you've heard this or know this, but for my patients who have suffered with COVID, I have one patient, she suffered in December. She was supposed to come into the office and have a sonogram, and she didn't show up to the appointment. So we called her. We were like, you missed your appointment. And she says, oh, but my mom has COVID and I was around her, so I didn't come. And, you know, we called to check on her because morbidly obese woman, she's about 375 pounds. So I was very worried about her, right? If her mom has COVID, she's been around her, what happened to her? But when she came back in January, she was in her uniform. I was like, oh, great, she's even back to work. She said, Dr. Burt, my mom and I had COVID and my brother. They don't live together. They're all in their separate homes. And she had one brother who did not have COVID. So he was responsible for going around and taking care of everybody, leaving food at the front steps. She said, I was this close to going to the hospital. She said, but my mama said, don't go to that hospital. Just keep breathing. Because the fear that an almost 400-pound woman goes into the hospital in a short breath, that she's going to end up in an ICU and perhaps end up on a ventilator. And here you see the deaths, still greater. Unfortunately, American Indians take the prize per 100,000, and Blacks are behind them in your great state. I don't know if you've ever seen this visual. This is a picture depicting what happened in the mid-1800s to enslaved women. This is a depiction, if you Google, of Lucy. Lucy, real name, and two other slaves are enslaved women that were written by a gentleman named Dr. J. Marion Sims. Dr. Sims has been dubbed the father of modern gynecology. He's been celebrated because many of the tools that we use in gynecologic surgery, he created. And all the women on the line, unfortunately, you know about the speculum. Well, he created that. But in the mid-1800s, Dr. J. Marion Sims also experimented on enslaved women. And it was at a time before anesthesia was readily available. But even when it became available, many of these women, of course, slaves were commodities, and the slave owners would give their slave women to him to operate on, because they would have their babies and suffer from vesico-vaginal fistulas. A fistula is an opening or a channel between two organs that's not supposed to be there. So with a traumatic birth, the bladder forms a little channel to the vagina. And I know it's lunchtime, sorry, but there's urine passing through and it causes pain, and they're not going to procreate that way. So Lucy, Dr. Sims actually wrote about her in his memoirs and talked about Lucy and how she was crying in so much pain. And many people, they've taken exception to the fact that a lot of folks have spoken out against Dr. Sims. They want to take away his title of the father of modern gynecology, and they've taken down one of his famous statues that was sitting outside of a medical center in New York City. And it said, well, we're paying homage to Dr. Sims. We need to pay our respects to Lucy, Aaerg, and Betsy. Some of those women underwent 30 to 40 procedures without anesthesia. And here is a very grayed out picture that you may or may not know her name. This is Henrietta Lacks. Well, Henrietta Lacks was a woman who, she had 5 children, and at the age of 39, she succumbed to her cervical cancer. But thanks to Henrietta Lacks, we have the knowledge that we have about cervical cancer. We know that HPV, the human papillomavirus, is the cause of 99% of all cervical cancers. We know how to do the Papa Nicolau smear, affectionately known as the Pap smear. We know how to do colposcopy. We know about the pathophysiology, thanks to this woman. The problem is no one got permission from her to use her cells. We call it the HeLa cells for Henrietta Lacks. And it wasn't until, she died in 1951. And in the 1970s, her family was made aware. and a settlement, a case was brought, and people, actually one of my professors from Morehouse School of Medicine, he's an older gentleman, he was actually a student at Johns Hopkins, and he was in the research team that was studying the HeLa cells. And here I share with you the Tuskegee experiment, the infamous Tuskegee experiment. I'm going to tell you something. I just asked one of my patients, she's 68, 69 years old. I just asked her today as I was seeing her this morning, and I said to her, I said, what do you know about the Tuskegee experiment? Because if you don't know, there are a lot of folks in the African American community who are saying they don't want that coronavirus vaccination because of what they did to us. And my patient shared with me the myth, the unfortunate myth and misinformation that is out there right now, and has been for years. So briefly, the story of the Tuskegee experiment from 1932 to 1972. The federal government allowed a study down in the county, I think it's called Macon County of Tuskegee, and 399 men who are poor sharecroppers were told, we want to study the bad blood that's going around in your community. So they had 399 men with bad blood versus uninfected men. It was 201 of those men. And so they told them, we're going to be studying you. You're going to get free health care during the course of this research. Okay, well, that's fine. And interestingly enough, that study was only supposed to happen for 6 to 9 months. They were testing some trial medications on them, arsenic, mercury. And when they realized it wasn't working, they stopped giving them those antidotes, right? But they continued the study. The goal, of course, became that they wanted to study and see how syphilis impacted the men and the women, because they're going to go home. They did not understand that it was a sexually transmitted infection. So these men were going home to their wives or their counterparts and infecting them. 1932 to 1972. Penicillin was found to be the cure for syphilis, at least early syphilis, in 1947. And the medication was withheld. So 1972, it didn't just come to a halt because they were finished and they were tidying up their research and they wanted to report it. A whistleblower, and that is how it came to light. So when you see your neighbors, your church friends, your family members, whomever, students, faculty say, I'm not getting that vaccine. These are the stories that are on the forefronts of their mind. Black bodies being undervalued or devalued, being studied. There was a story out of Alabama where a 12 and 14-year-old young sisters went to a family planning kind of clinic, and the mom was illiterate, didn't know how to read or write. On the consent line, she wrote an X. They sterilized her babies, hysterectomized them. So those were her only 2 children. So they never were able to have children. There's stories on and on and on and on. But the problem that we have today, even myself as an African-American physician, is dispelling the myths, letting people in these communities know that there was such a time, but that is a history that we learn from and that we need to overcome, because we have in our midst an opportunity to help, my screen is frozen, to help curtail this deadly virus, this pandemic. Kizzmekia Corbett, Dr. Corbett, is being hailed a hero, right? She's 35 years young, and she is the face of the Moderna vaccine. But I can tell you there's still a lot of folks who think, oh, she's been had, she's been bought, and they still don't trust her. So we're trying to get the message out, and this COVID disparity that is, shouldn't be. African Americans make up 13% of the population in the United States. Yes, we are disproportionately contracting COVID, hospitalized from it, having to get on life-saving measures like the ventilator, and then dying. Then we have Miss Sandra Lindsay, who's a nurse. She was that first one, if you remember, who received the Pfizer vaccine. I trust science, she said. And then I added my own little vaccination story. To the left, I got my first vaccine, and to the right, I got my second vaccine. And I too, like a lot of my colleagues, are doing what we can to go out there and share our story and tell people, you know, this is what you need to do, this is what you should do. Hopefully, if you have a primary care physician and have allergies or comorbidities, you know, talk to your doctors. We're sharing these stories. I can't tell you the number of posts on all the social media platforms, YouTube, Instagram, Twitter, Facebook, and we're trying to share because we understand that we have a history in this country. And people don't understand that, you know, we got to get this thing under control, not just COVID. We've got to get hypertension under control. We've got to get diabetes under control. We've got to get the things, the social determinants of health that we can control, we need to control. I was thinking about now former Surgeon General Jerome Adams. Here, this man was the United States Surgeon General, and he has shared during the last administration that he himself, though he is a physician, he suffers from high blood pressure, he's pre-diabetic, he doesn't look morbidly obese to me, but he says, I've heard him say in interviews, but I grew up poor. I grew up in, you know, not so great neighborhoods. And that continues to impact. That impacts men and women of different races, but it's such a disproportionate impact because as we go, so go our children. So go our children, and then the next generation, and then the neighborhood, and then on and on and on. So I'm going to leave it at that. I think my time is winding up. I still thank you for your committee and everyone who's participated. I am more than happy to address any questions that you may have if I can.
Awesome. Thank you. Does anyone have any questions? No questions? I do have one question for you, Dr. Burt. What are some key initiatives that your state is undertaking to help eliminate disparities that you're aware of?
Well, I'm not only a part of the, I sit on a few boards and on in some organizations. The Georgia State Medical Association, along with the, what do they call it? The Medical Association of Georgia, that is the state society under the American Medical Association. Our president, Dr. Lisa Perry Jilks, she has formulated a task force so that we can try to begin to speak to health disparities. We actually just signed off on a, what do you call it? Not a proposal. I'm such not a politician. A bill that they have presented to the state legislature, speaking of the social ills and health disparities as it pertains to the policing, and how racial discrimination is a health disparity. So that was about 2 weeks ago. I haven't heard anything from that. But my local organizations, we've been doing things like this, like going out to the lay public and doing talks, of course, through social media, to try to encourage our communities to embrace. But there's a plethora of opportunities, even pre-COVID, diabetes. I'm just thinking about diabetes is a big one, where most hospitals that I know offer diabetes education. The question is, how many people are going to the classes and taking advantage of learning how to eat better, how to make better choices? Many of us, I'm sure, have heard how to shop the perimeter of a grocery store, maybe taking time to get on a bus or a public transportation and go into a farmer's market. There's, interestingly enough, before we got on today, I checked my email, and there's a co-op called Eat Right Atlanta, where it's priced at different prices, but I paid $30 to have fresh fruits and vegetables dropped off on my doorstep. That helps me not go down the center aisles when I go to the grocery store. But if we can all learn to shop the perimeter of the grocery store, we would do a lot better and stop eating so much processed foods. Taste your food. Okay, now I'm just getting on my doctor tip. Taste your food before you go picking up the salt. But I see so many people, doctors included, I go in a doctor's lounge and they immediately pick up a salt shaker and start. I'm like, you didn't even taste those green beans. You have no idea how tasty they may be. We have to get away from those habits that take us down this horrible road. I didn't even talk about how in America during, I think it was back in 1800s, when the sugar rush basically happened in America, and how you can see on graphs when sugar was starting to be first exported into the country, the level of the levels and rates of sugar and diabetes just parallel each other. As Americans, we're addicted to sugar, we're addicted to salt. So we have to take advantage as best we know, and we have to start teaching the next generation, or we're just going to be talking about, worsening numbers as decades go on. So we have to start with ourselves, but we also have to teach our children and our grandchildren.
Awesome. I do have 2 questions really quick before we close out. One question from Pat Malone. She asked, do you, your organization, provide presentations to medical schools or PA school classes? That's one question. And the other one is, how are medical school programs changing the training of doctors to change the racist perceptions of their patients?
Oh, good question. So that's part of what I was mentioning with the Medical Association of Georgia, that we started a task force so that we can, take some maybe pilot programs and show people how they have biases, right? Just biases. There was a study, I didn't mention it in today's presentation, but there was a study that was, I think it's in the New England Journal of Medicine, where they surveyed medical students, first-year medical students up through residents, and they asked them basically race-based questions like, Black skin is thicker than white skin. Black women don't feel pain in labor like white women do. Those may be myths, but those myths continue to be perpetuated. So I know definitely at my alma mater, Morehouse School of Medicine, it is definitely something that is addressed all the time, because my school, the school I chose to go to, our focus is serving the underserved. So we actually have to do rotations. I actually went to Tuskegee and spent a month during my 4th year of medical school. Okay, that was 21 years ago, but still. And they want us to be out in the communities. I think one of the biggest problems that we have is that, you know, we don't have the access, right? A lot of poor folks and low socioeconomic classes don't have access. And there's a problem in a lot of states that did not expand Medicaid because it's the poorer communities that then suffer. We've had hospitals that have closed. I think it's been 9 hospitals in Georgia that have closed. We don't have family doctors and OBGYNs in many counties. There's 157 counties, I believe, in Georgia, and we have maybe one for one county. We definitely are doing better. Hospitals, I know, have, you know, they have diversity training, they have diversity committees to address. But again, just like I mentioned, having to start with the next generation, I definitely think it's important for us to go back to the medical schools and start there so that the biases will be shaken. And women in labor can get an epidural. I mean, it's as simple as that. I've witnessed that. I've witnessed anesthesiologists taking his slowpoke time. Oh, she's had 5 babies. I've witnessed sickle cell disease. I had to take a Caucasian nurse aside several years ago because she was upset that my pregnant patient who was having a sickle cell crisis was needing morphine and was accusing her of being basically just drug seeking. Like, do you understand what sickle cell disease does and how the cells sickle and get caught up in the blood cells and cause lack of oxygen and cause the pain in her joints? You don't. So you're gonna give her some morphine. And that patient, you know, she did fine. And she did not call us for narcotics when she was not having a sickle cell crisis. So we have to educate all areas of healthcare, as well as go back and to kind of grab them from the beginning.
Thank you. Thanks a lot. I have one last question. I have a couple questions left, but I'll share those questions with you at the end so that you can possibly respond directly to our participant. But if you had just 15 seconds to tell someone why vaccines can be trusted and will have a protective community impact, what would you say in those 15 seconds?
I would tell you that the COVID-19 vaccines, although there have been very, very few people who have had some bad outcomes, that does not equate to the almost, 500,000 folks who have died in this country alone. Trust the science. It is not new. It was built upon. It's how I like to say. So please, trust the science. If you want to wait for Johnson & Johnson, which is 1 single dose, that's fine. That would have been better for me too, but trust the science.
Awesome. Well, thank you. Thank you, Julianne, for spending this amazing hour with us. This is my first time hearing you speak formally, aside from following your social media platforms, and it's been truly enlightening. On behalf of the AAERG and our colleagues, friends, and partners of the Division of Extension, we hope we can call upon you to continue to engage us in meaningful dialogue. Please remember, participants who are listening now and who will be listening to the recordings later, your zip code shouldn't determine how long you live, but it does. As a reminder, Dr. Julianne Adams-Burke's full bio and recording of today's session can be found only on our SharePoint site. There are benefits to membership. We hope that you have enjoyed yourself and would return next week as we introduce our 4th and final speaker of our Black Voices Matter series, Ms. Dominique Green, graduating senior at Howard University, marketing and media intern with the Smithsonian African American Museum on History and Culture, and the president and CEO of PaperTag, a platform designed to elevate the voices and visibility of undiscovered artists. Thank you to everyone who joined this live discussion today, and to those who will be watching the recording. Thank you for taking the time to watch this phenomenal discussion. Have a wonderful afternoon and see you next week.